Hey, Dr. Kandula with Advent. Today, talking about some of the specific reasons why our CPAP success rate is so much higher than it is outside of our walls, about 267% higher, which is a big number. That comes down to a few different things. I think one of the things that sets us apart is our focus. All that we focus on are airway issues, upper airway issues, specifically nose and throat issues. That is where sleep apnea comes from. And if our entire focus is there, then we can make sure that we are delivering the solutions that are right for you. Another factor with our success on the CPAP front is that we understand and know that the nose is the start of the airway, period. End of sentence. There's no question about that. If your nose is working properly, you're going to have your highest level of success from a CPAP front or any other front, period. And if your nose is not working properly, your sleep cannot be proper. You cannot tolerate a CPAP machine in the way that you should. You can't tolerate any other treatment in the way that you should. So either your nose is on your side or it's against you. It's one or the other. And so you can either bury that and try to succeed with, sort of a game plan that's not going to work, or you can recognize that as a likelihood out of the gate and approach that in that mindset. I think another reason for why we tend to succeed on the sleep apnea treatment front, and specifically with a CPAP machine, is that we tend to view a CPAP machine as a bit of a last resort. It doesn't mean it's bad. It just means that I think most folks who have sleep apnea would rather not use a CPAP machine. And they might be willing or might be fine with that if that's sort of the last resort. And that's how we view it. I mean, I would say absolutely a CPAP machine can work. Absolutely a CPAP machine is not going to work properly if your nose doesn't work properly. And so we would never put you in a machine if your nose doesn't work. It's just not what we do. So I think that's a key factor is making sure that if CPAP is the right option for you, that number one, we optimize you for that treatment, and number two, we explain all of the options, and if that machine is the best option, explain why it's the best option. Again, many people could benefit from options other than a CPAP machine, and it's our duty to explain those options and kind of walk folks through. So I think understanding the lay of the land, and when we pick an option, if it happens to be CPAP, then that understanding goes a long way. And I'd say another factor that's really key as far as CPAP compliance is a nose that's working versus a nose that's not working. So a CPAP machine is a machine that's hooked up to a tube and then a mask. The mask can either sit on your nose and your mouth or just on your nose itself. Always a nasal mask is better than a full face mask, but that is only the case if your nose works. If your nose doesn't work, then you're not going to be able to tolerate a nasal mask, and then you have to default back to a full face mask. And from a setup standpoint, it's a night and day difference having something in your nostrils that's low key versus something that's on your nose and your mouth that tends to be, sort of claustrophobia inducing. So you have a choice, but you only have that choice if your nose works.